Have you ever noticed brown spots over your face or body or maybe in someone else and wondered why they're happening and what they are? I'm Dr. Nika Goyal, Chief Consultant Dermatologist and Hair Transplant Surgeon at Soul Derma Clinic, New Delhi. At times, we see brown spots or even gray colored spots over the face. This is known as pigmentation. Pigmentation can happen not only in women but also in men. So generally, we see pigmentation happening more after the age of 20, especially when you talk about melasma. So a lot of times melasma patients try to figure out that why has this pigmentation come up later in their life? How come they weren't born with that pigmentation? But this melasma does occur somewhere after 20 once the hormonal changes happen, and there are many factors involved. So commonly anywhere from 20 to even 50, we see melasma. There are times when you go through life with the perfect skin and you cross menopause, and that's when you start seeing those changes. Now, what are the causes of this type of pigmentation? The first is genetics. So a lot of times, again, patients say that, oh, but my mom doesn't have it or my dad doesn't have it. We don't know what our great grandparents had. We don't, genetics change over time. So genetics can be one of the causes. The second is sun exposure. Now people are more aware about sunscreen, sun protection, sun avoidance, but there was a time when maybe 20, 30 years of your life you have gone without even using a sunscreen or being outdoors most of the time. When we're younger, we go out to play, we go to the park, we go play sports outside, and that's a lot of oxidative stress and sun damage to the skin. The third is any hormonal changes. Commonly post-pregnancy or in pregnancy, we can see this type of pigmentation come up. You can even see it during menopause, even for men at times during periods of stress. So a lot of times, you can't figure out the exact cause. There are other contributing factors like vitamin deficiencies. Vitamin deficiencies are very underrated and a high chance of pigmentation when you are deficient. You may even supplement, but still that pigmentation takes time and requires further treatment. Now I'm going to give you the perfect example to understand what we're talking about. This driver, he is on the road, he's been on the road for 30 years. So the side that is exposed to the sun, that's on the window side, you can see so many changes: premature aging, wrinkles, textural changes, pigmentation, whereas the side that is not as sun exposed is much better off. So a lot of times, even if you think you're indoors, but there are windows, you're inside the car, you are still exposed to UV radiation, and that's why it's very important that you protect your skin and avoid the sun. Pigmentation can be so disheartening for the person suffering from it. It does impact the quality of life, and it's very important to understand that and be empathetic towards someone that's suffering for it, and be a little kinder to yourself if you have pigmentation. The good news is it can be treated, it can be suppressed, it can be reduced, but it's also important to take the right steps to do that and be under the guidance of a dermatologist. When we talk about treatment, the first thing is you need to find out the root cause. Are you deficient on any vitamins? Are you in the sun a lot? Are you using sunscreen? Do you have a family history? Have you gone through any hormonal changes like a pregnancy, thyroid, and so forth? Now, after you've figured out the underlying cause and you've taken proper treatment for that, we then go on to add like a skincare routine. So a good skincare routine also helps to suppress the pigmentation when it is oriented for your pigmentation. Topical ointments containing kojic acid, licorice extract, and so forth really help the pigmentation. Along with that, in-clinic procedures like Dermapen 4 for pigmentation, Q-switch laser works amazing. There are various types of peels depending on the depth of the pigmentation. This pigmentation may be in the upper layers, it may be in the deeper layers, and according to this, the treatment will be chosen. Furthermore, there are deeper peels that can be used like the Cosmelan peel, which works great for pigmentation. There's a joke amongst dermatologists that we tell you to completely avoid the sun, not go outdoors, but that is not very practical. So what are some things that you can do to give your skin the best shot? The first is wear a broad-rimmed hat. You can wear sunglasses, you can even wear a face mask, or these days you get hats that have a face mask inbuilt to protect your face from direct sun exposure. You can also take antioxidants, you can do IV glutathione therapy, which will also act as a preventative measure. Along with this, you can try UPF clothing for the body, and even UPF hats are available in the market now. Have a good, healthy, balanced diet, which is vitamin rich in antioxidants, and keep yourself well hydrated. And manage stress. That's very important. Stress can also flare up any pre-existing pigmentation. I hope I've cleared up all your doubts regarding pigmentation and melasma and how to take care of your skin and avoid any further aggravation of that pigmentation, as well as treating it. If you found this video helpful, or if you know anyone suffering from pigmentation, please share this video with them. You can also like and subscribe to my channel for further updates.